My name is Stephanie Chanis, and the disease I chose was bacterial meningitis. Meningitis is a disease caused by inflammation of the protective membrane that covers your brain. This inflammation is usually caused by an infection of the actual fluid that surrounds your brain and spinal cord. It can develop in response to numerous causes, such as bacteria or viruses. It can even be due to physical injury or certain drugs. There are 5 types of meningitis: bacterial, viral, fungal, parasitic, and non-infectious meningitis. The most common form of meningitis is bacterial. About 80% of all cases are bacterial meningitis. You can recover from this, but it can cause serious complications like brain damage, hearing loss, or learning disabilities. The infection can cause tissues around the brain to swell, which could interfere with your blood flow and result from a paralysis of anything along with a stroke. Anyone is usually at risk. Children between the ages of 1 month to 2 years are usually the most susceptible, but adults and even young children can get this disease. Some of the symptoms most common are high fever, headaches, inability to lower your chest to your due to the stiffness in your neck. In older children and adults, it'd be a little trickier, but some is confusion, irritability, and increased drowsiness. In younger kids, like infants, it can be harder, but it could be irritability, crying, vomiting, which will prevent eating, and possible seizures. Symptoms can be fast, even within 24 hours. If it's not treated, you can die from this. Bacterial meningitis is spread through direct close contact, such as discharges from your nose or your throat, such as coughing or sneezing. You can come more at risk if you are around people with the known disease. You can get it through kissing, sharing or eating the same food, toothbrushes, and even a cigarette. The main causes of bacterial meningitis is bacteria itself. There are 3 that are most common: Haemophilus influenza type B, also known as HIV, Neisseria meningitidis, and Streptococcus pneumonia. These are most common in the environment and can be found in your nose and respiratory system. In order to get a clear diagnosis of this bacteria, you can go to the hospital, and if it's suspected, they'll take samples of your blood or cerebral fluid, whichever is easier at the time, and it's a laboratory to go and do testing. In the case of bacterial meningitis, antibiotics can help prevent serious illness and the spread of the disease. Treatment. Bacterial meningitis can be treated effectively with antibiotics. Antibiotic treatment of the most common type can reduce the risk of death by 15%. Treatment is based on a person's health history, a physical exam, and the laboratory results. There are several ways to prevent this bacterial infection. Proper respiratory etiquette, like covering your mouth when you cough or your nose when you sneeze. Hand washing, healthy habits like good eating. Some things to avoid would be not to smoke or avoid cigarette smoke itself, and also not coming into close contact with people who are sick. But the most recommended is getting the vaccine schedule with the 3 different types of bacteria I mentioned earlier, like the HIV, the Neisseria meningitidis, and Streptococcus pneumonia. Here's the quiz. Question 1, how many types of meningitis are there? A2, B4, C1, D5? The correct answer is 5. Question 2. Adults are not at risk for getting bacterial meningitis? That would be false. A. Question 3. Which of the following is incorrect? You cannot get bacterial meningitis from kissing. Respiratory etiquette is not a way of prevention. C. Fever is not a symptom. Or D. None are correct. Correct answer is D. Question 4. There is no cure for bacterial meningitis. The correct answer is B. False. Which is not a way of prevention? Hand washing, smoking, hugging as many sick people as you can, or D, both B and C. The correct answer is D. And there are the clear answers. And this concludes the presentation on bacterial meningitis.